The British Prime Minister Boris Johnson, the man responsible for leading the UK's battle against coronavirus, has now spent nearly 24 hours in intensive care fighting COVID-19. Now, he has asked the Foreign Secretary Dominic Raab to deputise for him, and a short time ago Mr Raab gave this update on the Prime Minister's health.
I can tell you he's receiving the very best care from the excellent medical team at St Thomas's Hospital. He remains stable overnight. He's receiving standard oxygen treatment and breathing without any assistance. He's not required any mechanical ventilation or non-invasive respiratory support. He remains in good spirits, and in keeping with usual clinical practice, his progress continues to be monitored closely in critical care.
So that was the daily briefing a little bit earlier on today, and during that briefing we also were given the latest figures for the United Kingdom. So let's have a closer look at them. In just the last day, 786 hospital patients with coronavirus have died. Now, this is the highest reported figure so far for a 24-hour period. But experts say that the growth in numbers is actually lower than the predicted long-term trend. So this brings the total number of people who have passed away in the UK hospitals to more than 6,000. Let's get a little more now from our political correspondent, Jonathan Blake, who joins us live now. Jonathan, so we had an update about the Prime Minister, his condition, and also that Dominic Raab had very clear instructions from the Prime Minister about what he needs to do while the Prime Minister still remains in hospital.
Yes, the latest update from Downing Street came through just over 2 hours ago, and it indicates that there has been little change in the Prime Minister's condition. I'll read you what the spokesperson said. The Prime Minister's condition is stable and he remains in intensive care for close monitoring. He is in good spirits, and that is in line with what the Foreign Secretary, who's deputising for the Prime Minister, said at the news conference from number 10 Downing Street earlier today, and what we were told at around lunchtime by the Prime Minister's spokesman. So he will be spending a second night, it seems, in intensive care in St Thomas's Hospital here in central London tonight. As for the government, well, Dominic Raab, the Foreign Secretary, standing in for the Prime Minister, but facing questions earlier on about exactly what his role is and how much authority he has. And in answer to those, he stressed the importance of collective responsibility that is held by the Cabinet, the top team of ministers in Boris Johnson's government. And he said that ministers were united in carrying out the clear instructions given by the Prime Minister. So he and Downing Street are being very careful to almost portray him as a facilitator, if you like, of the government's response, rather than someone who is taking charge and making any big decisions in the Prime Minister's absence.
Now, Jonathan, when it comes to the figures themselves, we've had the highest reported figure so far of hospital deaths, but in fact a little bit of positive news because the growth in numbers is longer than predicted. So are we seeing potentially some of the impact of the lockdown that the UK has been under for the past 2 weeks, now into the third week?
Possibly, and that was the sense we got from the Chief Scientific Advisor at the press briefing earlier on today. Sir Patrick Vallance caveated his comments, but did say that there was a chance that these figures were starting to show the flattening of the curve. And that is what the experts talk about when they look to these figures of the number of new cases and the number of hospital admissions, particularly to see the impact of the restrictions that have been in place on the movement of people around the UK. And they've been in place now for a couple of weeks. So, as I say, very cautiously, the Chief Scientific Advisor did suggest that there was some positive signs that those restrictions were having an impact and the number of cases was flattening off. But asked whether there will be an end to those restrictions or an extension of them, the Foreign Secretary, Dominic Raab, said it was too early to make any decision of that kind.
Jonathan, thanks so much. The message in the UK still very much stay indoors, stay at home. Let's take a look at what's happening on mainland Europe now. Let's turn to Spain because the country has seen a rise in its daily figure for coronavirus-related deaths after 4 consecutive falls, in fact. 743 deaths were registered in the latest tally, but authorities are saying that some of this number can in fact be attributed to deaths which took place over the weekend but had not been recorded yet. yet, so a bit of a lag there. More people with the virus have died in Spain, in fact, than any other country apart from Italy, which leads us on to Italy. Let's take a look at the situation there. Doctors and nurses from Romania and Norway are being deployed to those really badly affected areas in the north of Italy to help fight this pandemic. The teams, 35 people in total, are heading to Bergamo and Milan. Italy now has more than 16,500 deaths from coronavirus. In France, the number of people who have died from this virus has passed 10,000 people. Additional measures to contain it are about to come into force. From Wednesday, any outdoor exercise will be banned in the capital between specific times, between 10 in the morning and 7 in the evening. And all residents leaving their homes will be required to carry a permission slip explaining exactly why they're outside. So are these new rules being welcomed? Let's have a look at this reaction.
There's no difficulty. For certain people, we have to explain and re-explain the manner in which to fill out the permission slip, because for some it's not always clear, but it's okay.
Frankly, it's starting to feel long. I think it's starting to really weigh down on people mentally. Apart from that, well, we know we don't have any choice. This is what must be done. We ask ourselves why these measures weren't taken earlier. Personally, I think it's quite late that they've decided to take these draconian measures.
So some of the reaction there from France, in fact, where those stricter measures are going to be implemented from Wednesday. Let's turn to the United States now, where New York is continuing to be at the very centre of the COVID-19 outbreak there. Now, speaking in just the last few hours, the New York Governor, Andrew Cuomo, said that Monday saw the largest single-day increase in the number of deaths.
The bad news is 5,489 New Yorkers have lost their lives to this virus. That is up from 4,758. That is the largest single-day increase. And we talk about numbers, but that's 731 people who we lost. Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother. So a lot of pain. Again today for many New Yorkers, and they're in our thoughts and prayers.
Andrew Cuomo, absolutely spot on. You have to remember that these are individual people and the pain that takes place when we lose loved ones and family members. Now, there are, though, some promising signs. New York City Emergency Department is saying that the number of patients who are admitted with coronavirus-like symptoms has, in fact, slowed. Near the end of last month, over 1,500 people were being admitted, but as you can see, that has dropped down to around 500. Mark Levine-Chai of the New York City Health Council Committee says that this shows that the isolating measures that are being put in place in New York are in fact paying off, according to his tweet. Now, across the nation is, however, a very mixed picture. A number of West Coast states, including California, have seen a drop in the number of infections, down from a high of 1,400 to under 1,200. There were some of the first states to confirm cases of COVID-19, but states like Florida have seen rises in both the infection and the death rate. Another state seeing a rise in cases is Louisiana. Dr. Rebecca Guy is the CEO at Louisiana State University Healthcare Services.
We had a perfect storm again with Mardi Gras coinciding with local spread here in the United States, and before we knew that this virus was circulating widely. So it was 2 weeks after Mardi Gras that we saw our first death and the numbers starting to spike. We have seen enormous spikes. We have here in Louisiana, we call them parishes, and the rest of the U.S., they're called counties, but 10 of the 20 highest number of cases per county in the U.S. are in counties in Louisiana.
Now, another developing consequence of coronavirus in the United States are these new statistics on how African-American communities have been especially hit by COVID-19. As of Sunday, 1,824 African-American Chicago residents have been diagnosed with COVID-19. Now, they make up just over half of all coronavirus cases in the city, but African-Americans only make up 30% of the Chicago population. And when it comes to coronavirus deaths in Chicago, African Americans account for 2/3. So let's analyse this with the BBC's Anthony Zerka, who's watching these figures from Washington for us. And Anthony, it's not just, in fact, in Chicago where the African American community are disproportionately affected by COVID-19.
Exactly. There have only been a handful of states that have reported these figures broken down by race, but the states that have done it have shown time and time again this sort of disparity. In places like New Orleans, in cities like Detroit, Michigan, and New York State, you see the same sort of thing, which raises a question of why. And some of the reasons could be that African Americans have a higher predisposition for pre-existing conditions like hypertension, obesity, breathing issues. It could be that they are in positions of jobs that are deemed essential, so they're still going and working at grocery stores, working at healthcare centers, things like that, that are exposing them to the virus. Or it could be a reflection of the inequalities in American healthcare, that certain segments of the population don't have as much access to medical professionals. They aren't getting the treatment they need, or are going undiagnosed, and therefore they aren't showing up in emergency rooms until they require critical condition care, or they actually end up dying there.
Anthony, another issue, another aspect of the US response that I want to get your analysis on is how the US response, we want to have a look at why US states, why the whole country hasn't locked down in the same way as other countries. So if we take a look at the start of last week, for example, 30 states, Anthony, had instructed residents to stay at home, with others ordering lockdowns only in certain areas. More went for statewide lockdowns then over the coming days, including one of the biggest, Texas, which is home to 29 million people. Florida then was next after the governor there, Ron DeSantis, changed course, having previously resisted bringing in a statewide order. Other southern states followed, with South Carolina becoming the latest earlier on Tuesday. So, Anthony, just explain to us why we're seeing such a difference across the many states of the United States.
Right, and part of it is because of the way the United States system of government is set up. State governors, state governments have considerable power, whereas the federal government can't necessarily direct them to shut down. Now, Donald Trump, the president, as well as other federal officials, can certainly urge states to follow these guidelines. And one of the criticisms of Donald Trump recently has been that he hasn't been putting enough pressure on the individual state governors who have been reluctant to shut down totally, to order these shelter-in-place directives, hasn't been pressuring them enough to do so. But the power, by and large, rests in all of these 50 states. And the idea is this is generally a good thing, this idea of federalism, because it lets different states tailor their responses to the conditions on the ground. But when you're dealing with something like this pandemic, the concern is that there needs to be a consistent national response that will keep some of these other states that may not have a lot of cases right now from becoming hot spots weeks or months down the line.
And Anthony, I also want to get your thoughts on who's in charge of the whole American response to COVID-19. And it's in relation to this picture from the White House last week. This is alongside President Trump. We can see Deborah Birx, the response coordinator for the coronavirus task force. We can also see Jared Kushner, the president's son-in-law and senior advisor, Rear Admiral John Polovchik, who's tasked with streamlining the U.S. supply chain, and also Vice President Mike Pence, who leads the coronavirus task force. And if that wasn't enough, we've got Peter Navarro, who's the director of trade and manufacturing policy. Anthony, I thought it was Mike Pence who was in charge. Who's in overall charge of the United States response to this disease?
That's a very good question. I think that's part of the concern, is that there seems to be conflicting viewpoints within the administration, with different people offering different directives. If you look behind the scenes, someone like Jared Kushner, Donald Trump's son-in-law, has been taking on an increasing role, even perhaps eclipsing Mike Pence as someone who is facilitating communications between the administration and between outside businesses. Of course, you have the healthcare officials, Birx, as you mentioned, and Anthony Fauci, who are the ones ones who are medical experts. They are running into conflict with people like Peter Navarro, as you mentioned, the trade representative, who has been pushing much harder for these experimental drug treatments, hydrochloroquine treatments, whereas the medical professionals are a little more reluctant to order something like that without full testing. But when it comes right down to it, it's Donald Trump. He's the president. He's the one in charge. The question is, sometimes when you hear lower level staffers, some of the people in that room, some of the people elsewhere issue directives, is Donald Trump going to follow up and echo that line, or is he going to say something different? But with our system of government, with the way the White House is set up, in the end, what Donald Trump says, he's the final authority.
He's the final authority, Anthony, when it comes to a lot of people praising Andrew Cuomo as well, the New York governor, but Donald Trump, the final authority. Anthony, always really good to get your thoughts. Anthony Zerka there in Washington. So let's catch up with what is happening in China, because for the first time since the country began monitoring the toll of this virus epidemic back in January, officials there are now reporting no new deaths from coronavirus. New infections have also dropped, and all 32 cases reported came from overseas travellers who are entering into China. There are, however, questions about whether the government has been underreporting their figures. Steve McDonald reports from Beijing.
Many have suggested that the figures here can't be possibly catching all the cases, neither all the infections nor the deaths. But in a way, it doesn't really matter, because really what matters is the trend. I mean, if the sort of loop goes like that, or like that, it doesn't really matter how high. I mean, there could be 10 times as many people have died here as come up in the figures, but as long as the trend is right, and it does seem to be, in terms of us coming out the other end, well, it's quite instructive and offering hope for other countries.
Well, thanks to Steve McDonald there. Now, this week marks 100 days since the World Health Organization was told about this mystery illness in Wuhan, and the city has, as we were saying, just reopened to the outside world. The majority of stores have opened up, and residents are now able to travel again, and you can see people arriving at Wuchang Station. This is in Wuhan. 11 million people have been in lockdown there since the 23rd of January. Well, the World Health Organization has praised China over its handling of this outbreak, including its rapid quarantining of cities. But the government has also faced criticism for suppressing information about the virus. Now, of course, in February, this Chinese doctor, this is Li Wenyang, tried to raise the alarm about the rapid spread of COVID-19. He was silenced by police. He, of course, later tragically died after contracting the virus at Wuhan Central Hospital. Sophie Richardson is the China director for Human Rights Watch.
Rather than rebutting false information and sharing reliable data itself, what the Chinese government moved swiftly to do was accuse people of, quote, spreading rumors and finding ways of silencing them. And that included Dr. Li Wenliang, who you just mentioned. It's also extended to citizen journalists like Chen Qiushi, who has disappeared about 2 months ago and hasn't been seen since. But it also ranged all the way through censoring social media posts, including from families of people who were infected with the virus who were simply trying to get help, and censoring articles or other kind of news that people might have found useful and helpful in this time of crisis.
Well, in Japan, Prime Minister Shinzo Abe has declared a state of emergency in Tokyo, Osaka and 5 other regions in the country. People are being advised to stay inside. Businesses will shut. Coronavirus infections in Tokyo have more than doubled in the past week to around 1,200. And this comes after the government announced a massive stimulus package, which Mr. Abe described as among the world's biggest, to soften the economic blow. Rupert Wingfield-Hayes is in Tokyo.
If you take Tokyo and its surrounding areas, it really is the world's largest metropolitan area, with a population altogether of around 37 million people. So this state of emergency really does affect a vast number of people. And we understand it's going to go into effect initially for a month. But it won't be the same as the lockdowns that have been declared in the UK or in America or in some other European countries, because the Japanese government simply doesn't have the power to do that. This is an advisory. The Japanese government is requesting that businesses close. It's requesting that ordinary citizens stay at home as much as possible. But a lot of life will continue to go on. The Tokyo transportation network will continue to run. A lot of people will continue to go to work. But it's hoped, but because this is a disciplined and law-abiding society, that it will be enough to stem the growth of COVID-19 here.
Now, coronavirus affecting every corner of the globe. Brazil, there the country's health minister, Luis Henrique Mandetta, has said he'll continue in his job battling this pandemic. But over the weekend, the president, Jair Bolsonaro, clashed with Mandetta, accusing him of lacking humility after he criticised the president's attempts to limit social distancing rules. But after a meeting with Bolsonaro, Mandetta has vowed to fight on.
We have a fight to try to protect our society. A doctor never leaves his patient. I will not abandon the country, but I want to get better working conditions for everyone here. The only thing we ask is to be given a better environment to work here at the Ministry of Health.
Well, let's cross over to speak to our South America correspondent, Katie Watson, joining us live from Sao Paulo. Katie, a difficult situation when you've got the leader of the country and the health minister during a global pandemic at odds with each other.
Absolutely. It's quite remarkable, really, on Monday, at a time when the numbers of coronavirus cases keep rising, the deaths keep rising, there's just been this political spat that's getting bigger and bigger. So Monday afternoon, we heard rumours that Jair Bolsonaro is going to get rid of the health minister. And this is, there were a lot of rumours circling about this because the health minister his approval ratings have been going up. Meanwhile, Jair Bolsonaro's approval ratings have been going down because of this difference, really. Jair Bolsonaro thinks that social distancing is almost pointless, that it's a small little cold or flu, and that really it's nothing to worry about, and people need to get back to work. The economy needs to keep running. But of course, that's set him apart from the state governors who've put in tough measures and the health minister. So what we saw was Mandetta coming out saying, almost effectively saying he'd won, really, that he'd won this battle, that the government was repositioning, that he would keep his job. A doctor would not abandon his patients, he said.
And we're getting lines coming from the health minister saying that Brazil has a serious problems of availability of things like respirators. How prepared is the country?
Well, this has been a concern. He's said previously that he expects by the end of April that the health system will collapse. There is a big concern that the numbers are not being reported. Certainly the testing is not near, the numbers of testing is not nearly sufficient. People are very worried about the fact that the real figures, and we're talking 13,000 cases have been confirmed and now over 600 people who've died. These are really masking much bigger figures in the country. So at the moment, the numbers are still very unknown. The consequences and the situation in the next few weeks, again, still very unknown, and people are very concerned about what's going to be happening in the next few weeks here in Brazil.
Yeah, Brazil bracing itself. Katie, as always, thanks so much, Katie Watson there live from Sao Paulo.